people's energy costs go up, grocery costs go up, and now their healthcare costs skyrocket. This is an administration that is about corruption, chaos, and cruelty. They should come to the table and negotiate with us. Donald Trump promised to bring people's prices down. He's done the exact opposite. He should come to the table and negotiate with us to help people through this healthcare nightmare that right now will only get worse because the big beautiful bill is also gutting close to $1 trillion out of Medicaid. This will be the worst healthcare disaster our nation has ever seen, with more people poised to lose health insurance than at any other time. This is a uniquely American problem. The number one reason people go bankrupt in America is still their healthcare costs. This does not happen in Canada, does not happen in England, does not happen in France, does not happen in New Zealand. This is an American problem of the Republicans making, and we're demanding that they do something about the pain and the hurt that American families are experiencing and the fear as they look at their healthcare costs going up in my state well over 100%. These are working Americans who expect more from their leadership, and I, for one, will continue to stand with the people of my state who are demanding help at a time that so many are hurting. I'm excited to bring up my colleague, truly someone who understands that you can't lead the people if you don't love the people, Senator Tina Smith.
Well, good morning. I think it's still morning, everyone, and thank you so much, Senator Booker. And I want to also particularly thank the folks standing behind me who aren't from Washington, D.C., to tell us about what people are really talking about. And, you know, I think that for most Americans, healthcare isn't about politics. It's personal. Is your family healthy? Are your children healthy? Can you get in to see the doctors and the providers that you want? Can you afford to get the care that you need? And I think it is also true that most people in this country would agree that our healthcare system is broken. It takes too long to get what you need, it costs too much, and it might not even be there when you need it. And so this summer, when Donald Trump and Republicans passed their so-called One Big Beautiful Bill, what did they do? They made this worse, not better. They kicked millions of people off of their health insurance, and they made everything more expensive just when Americans are struggling to figure out how to afford their lives. And in fact, what they did do is they found trillions of dollars to give huge tax breaks to big corporations and billionaires. But what didn't they do? They couldn't find the money to extend the ACA tax credit so that people can afford their health insurance. Plenty of money to give huge tax breaks for billionaires, but not enough money to help regular people afford their health insurance. And now here we are. We're just a few days away from November 1st, where millions of Americans are going to see their health insurance premiums double or triple. And I can tell you, in Minnesota, this is what people are seeing and feeling. This is what it looks like for people in my home state. I have talked to providers in Minnesota who know they have patients, who need health care for chronic conditions, who are faced with either dropping their health insurance or somehow figuring out how to literally skip going to the grocery store so they can afford their premiums. I've talked to a young woman who works for a nonprofit child care provider, and she is going to drop her health insurance because she can't afford it. She doesn't have health insurance through her work. And what does this mean? It means she's going to postpone starting her own family. We are nearly 30 days into this shutdown, and Republicans and Donald Trump are keeping the federal government shut down rather than working with Democrats to try to figure out how to solve this problem. And I can tell you, Minnesotans are not happy about this. Farmers and ranchers, small businesses who rely on the health insurance exchange to buy their insurance, they are struggling to make a profit right now, and Donald Trump and Republicans are making it worse by raising the cost of their health insurance to levels that they cannot afford. And I can tell you it is particularly rubbing salt in their wounds to see that at the same time Trump is sending $20 billion to Argentina to bail out Argentina and to bail out the wealthy Wall Street fund managers who are going to benefit from this bailout, but he refuses to help people afford their health insurance. So let me just be clear. Republicans are refusing to negotiate with us. They just keep doing the same damn thing over and over again and demand that we vote for their so-called clean CR, but there is nothing clean about a CR that raises healthcare costs for people so exorbitantly. It's bad for America, it's bad for Minnesota, and I'm not going to help them do it. The best time to fix this was weeks ago, but the next best time is right now. And we can do better than say to America that you have two choices. One choice is skyrocketing health insurance premiums, or the other choice is decimating the nutrition programs that help people put groceries on the table. That is not a real choice. That is not the choice that I will accept. We can do better than that. Now, behind me, we have some incredible folks who can tell you what they're seeing and hearing out in the country. And I'm excited to introduce to you Dr. Fran Patel.
Hi there. My name's Dr. Francesca Haydanek, and I'm an OBGYN working in Western New York. I spend my days and many of my nights taking care of high-risk patients who rely heavily on government assistance to receive care to survive their pregnancies. I'm often told in real life and online, where I educate about obstetrics and gynecology, that I, as a doctor, should not be political. But healthcare is political, and our current government shutdown reflects just how vital a functioning healthcare system is to our country. If healthcare insurance subsidies aren't renewed, families could see their insurance double or even triple next year. And for many of my patients, many who are mothers who already struggle to make ends meet, that means making the choice. Do they pay for health insurance, or do they pay for food and rent? And when my patients have to make that decision, which they already do daily, I see the fallout every single day. My non-pregnant patients are unable to see their primary care physicians prior to their pregnancies, which means they enter pregnancy as a high-risk pregnancy because they couldn't get their diabetes and hypertension controlled prior to becoming pregnant. I see women skipping prenatal visits because they can no longer afford the gas to come to my clinic, and I see mothers delaying care until their third trimester because they've lost their health insurance. I see patients rationing their insulin, skipping blood pressure checks, or showing up in labor with no records, no labs, no care, and no idea how dangerous that their situation could be. Because in my world, those delays are deadly. When a woman can't afford care, preeclampsia goes undiagnosed. I, as an OBGYN, have seen what an eclamptic seizure and subsequent stroke can do to the brain. Gestational diabetes goes unmanaged, and I, as an OBGYN, have to be that person who manages a shoulder dystocia for a 10.5-pound baby whose mother wasn't able to afford her insulin. And a baby who could have been saved isn't there when I put the Doppler on her abdomen. I've had to be the doctor who had to deliver a baby who should have been born alive, but was born still. These are the continued and worsening realities of my future if my patients can't afford health care. I practice in both a high-volume urban hospital serving a high Medicaid population and in a small rural hospital. I see how the lack of care in both of these areas affect outcomes for my patients, and it's only going to worsen if healthcare premiums continue to skyrocket and rural hospitals shut down. We're not just fighting for better outcomes for our patients, we're fighting to keep our doors open. When premiums rise and patients lose insurance, our labor units fill with patients who are sicker and who don't have insurance, and that financial strain is unbearable. Once a maternity ward closes, it almost never reopens. So yes, this shutdown is political, and so is healthcare, but the consequences of the lack of healthcare are deeply personal. Every mother deserves to walk into a delivery room without fear of losing everything, her home, her health insurance coverage, or her life, just because she dared to have a baby in America. We need to extend the subsidies that make care affordable. We need to protect maternal health programs to keep our patients alive, because when we fail our mothers, we fail our families. I became an OBGYN to deliver healthy babies. I never imagined I'd have to stand here pleading for my patients' ability to afford the care that keeps them alive. Thank you. Next is going to be Dr. Anita Patel.
Tough act to follow. Good morning. My name is Anita Patel. I am an associate professor of pediatrics, a double board certified pediatrician and pediatric critical care attending, researcher, and most importantly, a mother of two. I have dedicated my life to improving the health of our nation's children through clinical care and pediatric research. I am here today because we are witnessing a healthcare crisis unfold in slow motion. and we have the power to stop it. The numbers defining this crisis are terrifying. $1 trillion in healthcare cuts, 22 million people facing crushing premium hikes, and millions at risk of losing their health insurance, but numbers do not tell the full story. I want to tell you how this crisis will affect the lives and families, specifically the lives and families of the children I treat. Over the past 15 years in pediatrics and pediatric critical care medicine, I have seen firsthand what happens when children lose access to health care. I have intubated teenagers in diabetic comas because they had to ration their insulin that their families could not afford. I have battled uncontrolled seizures in the ICU, which can cause permanent brain damage because parents had to choose between their child's seizure medications and paying their rent. I have held the hand of a mother whose daughter's treatable asthma became a life-threatening crisis that killed her because they couldn't afford albuterol. These stories are both tragic and tragically common. When healthcare costs become unbearable, life-saving EpiPens do not get refilled. A child's sinus infection turns into meningitis, and a ruptured appendicitis leads to septic shock from delayed care. In medicine, we take an oath. First, do no harm. Right now, inaction is causing harm, and the children I have dedicated my life to protecting will bear the consequences. Every day I go to work, I see the absolute best of what our healthcare system can do. I see brilliant doctors and nurses performing miracles. I see children who survive against impossible odds. But I also see the worst consequences of policy choices that force families to choose between medical care for their children and other necessities. I am here to warn you, Congress's inaction is about to unleash an avalanche of suffering on our nation's children. As both a doctor and a mother, I am proud to stand with Senator Warren and these Democratic leaders who are fighting for health care for our nation's families, and most importantly, the future of our nation, our children. Thank you.
Thank you. Hi, I'm Heather Irabunda. I am a OBGYN, and I come to you as a person who provides reproductive health care in a working class community in the Bronx to ask, why are we trying to worsen our healthcare crisis? Unfortunately for my patients, they already face so many challenges to survive. There is a food pantry I pass on my way to work, which I have watched the lines get longer and longer for over the past few years, but over the past few weeks, it's been worse. I already have to try to work on creative ways for my pregnant patients to get insulin, visit a nutritionist, get glucometers, and other medical supplies when they are newly diagnosed with gestational diabetes because there are gaps in coverage by existing health insurance available, and they were unable to get their prior diabetes or pre-diabetic conditions managed before pregnancy. I already have to provide some of my pregnant patients their first meals of the day in my hospital at 3 p.m. when these folks get brought in by ambulance because they passed out on their way to work. On behalf of my patients who rely on Medicaid to receive their care, I ask that we make sure to keep access to affordable health care for them.